some. All right. So thank you so much for having me and for that introduction. I'm going to be talking to you all about athletes and eating disorders tonight. What to expect from the talk. So I worked with our lovely host to talk a little bit about what they were hoping for this, and this is what we came up with. So we'll talk about just a general overview of what eating disorders are. We'll talk a little bit about prevalence rates of eating disorders in athlete populations. We'll talk through a little bit in terms of signs, symptoms, risk factors, and performance consequences of eating disorders in athletes. We'll talk about ways to support an athlete who might be struggling with disordered eating and/or an eating disorder. And then we'll talk a little bit about resources for further help and what that can look like. So to start off with eating disorder diagnoses, there's a lot of words on this. So I'll just kind of go through the 5 main disorders that we can currently diagnose in the most recent version of the Diagnostics and Statistics Manual, which is the manual that we use for diagnosing mental health conditions. We have anorexia on one end. And so this is really looking at significantly low body weight by restricting energy, food intake. A core piece of anorexia is this really intense fear of gaining weight. There's a couple different types of anorexia as well. There is a binge purge type and a restricting type as well. For bulimia, what we see is this recurrent binge eating, which is eating a very large amount of food in a short amount of time. It's usually accompanied by feeling pretty out of control, and then there's usually some sort of compensatory behavior following a binge. So that could be vomiting, that could be laxative abuse, that could be excessive exercise, etc. And then we also have binge eating disorder, right? Which is characterized similar to bulimia in terms of eating large amounts of food, feeling that loss of control, but there's typically no compensatory behavior following that. There's a couple others that are a little bit more nuanced, more things to consider. So there's a category called OSFED. And you can see there's a bunch of different types there. I think particularly for looking at athletes, you'll see it's in red there, orthorexia, which is not a current DSM diagnosis, but kind of falls under this OSFED category, which is an unhealthy obsession with healthy eating. And it mostly revolves around food quality, not quantity. And so with a lot of athletes that I work with, we see just this intense obsession with, I can only eat clean. And what that typically will turn into is that the list of potential safe foods gets smaller and smaller. We also have there on the right side of the screen, ARFID, which is avoidant or restrictive food intake disorder. Similar, there's a few differences from an anorexia diagnosis. And again, I don't have to get too into the nitty gritty there, but just know that is another category that we can look at if someone's symptoms don't fully encompass or fit criteria for these 3 kind of the main eating disorders that we typically see. So prevalence rates of eating disorders in athletes. If we are looking specifically in athlete populations, what we know is that this is one of the most common mental illnesses in elite athletes. Studies vary. There's a pretty wide range in terms of prevalence rates depending on the level of athlete that we're looking at. So across a wide variety, we're looking at about 0 to 39% in male athletes and about 6 to 45% in female athletes. And these numbers are encompassing adolescents, professional, USOPC, collegiate, right? So the whole realm of those who are considered athletes. So pretty varying rates, but right, 39 and 45% are pretty high. Interesting thing to note here, among elite high school athletes, the prevalence tends to be much higher among athletes than non-athletes, and it's higher for females than males. So there's some other intersections there with different identities that are playing a role in some of those rates. And then what we know about athletes with eating disorders is that these issues can be maintained by a lot of just perpetuating factors, right? So it could be that they have approval by the coach. They get rewarded in terms of like, hey, I've noticed you've lost weight. That's great. Keep it up. Or, hey, I've noticed you're putting in X amount of extra workouts, or you're staying late, or you're coming early, which can be rewarding, right? They're getting praise for this, which might perpetuate their behaviors. Oftentimes we will see some initial success with athletes who start engaging in disordered eating. their performance might get better initially. And so then that might really propel and instill some beliefs in them that, hey, I got to keep doing this because this is impacting my performance. I want to talk a little bit about different factors that we see, again, just pending other types of identities. So I want to look at gender as a component here. And I do want to make one note on inclusivity here. Most of the literature really just focuses on the binary female versus male athletes. There is not a lot of research in terms of trans athletes and rates there, but we do know that trans individuals in general do have higher rates of eating disorders. So that is a research population that is not being studied in athletes. And I think just with ongoing focus on trans athletes, we will start to see some more of that, but there is not a lot of that research right now. So if we're looking at athletes who identify as female, they are absolutely considered a high risk group because of just that unique sport environment. There's a lot of pressures about weight, eating, appearance, and performance. And that can come through in comments about weight. I have worked with many collegiate coaches who quite regularly will throw out comments about weight or body size or shape that really don't have anything to do with the actual sport or performance. Revealing uniforms can be another thing. And then again, if we really break down the type of sport, there is an aesthetic quality to performance for some sports. I think about ballet, for example, or gymnastics, some of these sports where you really do get touched on a physical component as well. The highest prevalence among female athletes tends to be in the endurance and aesthetic sports. So triathlon, track and field, ballet, gymnastics, for example. Really interesting study came out of Norway. After over 2 years of active competition, we saw rates of adolescent athletes EDs increase from about 15% to 20%. So what this tells us is that over time, the longer an athlete competes at a high level, the more at risk they are of developing an eating disorder. Another transitional piece with this next part is overall, when an athlete retires from sport, we can also see eating disorders increase. This study found a rate of from 18.7% when actively competing up to about 27% when they retired from sport. So again, looking at that transitional phase, when they're no longer in their sport can be a very large risk in terms of developing or maintaining an eating disorder when they don't have their sport as an outlet anymore. That can then be further complicated by distress related to the body composition changes post-retirement, right? So if you're not engaging in that level of exercise anymore, you are going to see some body changes, which can be really triggering in terms of developing an eating disorder. For male athletes, some things to keep in mind. What research tells us, eating disorders are more frequent in male athletes compared to non-athletes. Most frequently associated factor for eating disorders is weight-sensitive sports for male athletes. So things like boxing, wrestling, right? Any sort of weight class sport where that is a factor in terms of competition. One study again found that in adult male elite athletes, prevalence rates were up to almost 33%. And the prevalence was not higher in that young or adolescent male elite athletes. So again, showing off this pattern that the longer an athlete participates in sport, the more at risk they become. And there's also just some suggested gender risk factors. So a drive for muscularity, steroid use, and then sexual orientation can also play a role in that. Another study that was pulled, the prevalence of disordered eating, if we're kind of looking at things sport by sport, cycling was the highest in terms of male sports with about 50%. Gravitational sports, so things like ski jumping, 24%, and then of course those weight class sports. Okay, so transitioning a little bit just to think more broadly about what eating disorders can look like. So I have just a list here of some potential signs and symptoms. Some things I want to point out here is that this can be both physical, but it can also be mental and emotional as well. So you might see some things like a loss of period in female athletes. You might see stark changes in weight or body shape, right? So some things that we can really look at someone physically and notice some things, but there's a lot of things otherwise that should be on people's radars. So for example, Are you working with an athlete who has chronic injuries and continues to train when injured? So multiple stress fractures, or is reporting significant pain, but still going out and running 10 miles every day? Are you noticing shifts in mood and how they typically present themselves in their behaviors or in their emotions? Are you noticing new or increased conflict, more irritability? Are you noticing more obsession about training, about body image? Are they starting to talk more about workouts and just have this kind of tunnel vision in terms of their whole day and their whole life is planned around training routine? And then also, are others voicing concern? I think one of the biggest ways that I've caught eating disorders before, been able to intervene in a collegiate athletic setting, is by teammates or coaches noticing things and kind of coming and saying, hey, I'm concerned about so-and-so, because oftentimes it is teammates who see a lot of these signs and symptoms first. I want to talk a little bit about healthy versus unhealthy athlete exercise and how that plays a role in athletic populations. So I just have kind of a chart here that looks at the differences between what is healthy exercise and what is unhealthy. For healthy, it's really intended to promote well-being and physical and mental health. Recommended weight and health are sustained during repeated exercise, so we're not seeing significant and quick shifts. People who are healthy, who exercise in a healthy way, are exercising with peers or in social situations. They can be spontaneous in their workouts and have more of a balanced routine. They incorporate fun and relaxation. It can have more flexibility, more freedom, more choice, and really align with their values. What we see on the flip side of that is we see people spending a significant amount of time prepping for exercise, engaging in it, and recovering. So again, that kind of tunnel vision, other things end up not mattering as much. And there's so much time and effort being put into what these workouts are going to look like. We will see a decline in performance oftentimes, a lack of interest in other activities. So again, maybe spending time with family and friends or academics or other interests that they used to have just aren't as important. Exercise can become very rigid or obsessive. So for example, if they don't work out at the same time every day, or if they don't engage in the same set of exercises every day, they can feel like they've lost their fitness or won't be able to compete at the same level, right? It's really distressing to them if they veer off course. Continue training with injuries or fatigue. So waking up, recognizing they have not gotten enough sleep, have not recovered, but still going out and doing something anyway. Starting to see their self-worth be determined by their exercise or by their performance. And then also some social media used to conform to that ideal exercise routine. So you might see some obsession or some focus on following certain athletes or following certain pages that continue to help perpetuate some of these obsessive and rigid patterns. And then I have this arrow here that says there's really a catch on this unhealthy side. Because if you think about this continuum of physical activity where you have very sedentary people on one end of the spectrum and very unhealthy levels of exercise on the other, athletes, especially high performance athletes, really do fall kind of in that physically active to unhealthy levels of exercise. If I am working with an athlete versus a non-athlete, and I have an athlete come in and say, yeah, I'm working out about 4 to 6 hours a day in a collegiate setting, that's not unusual. In fact, that really is just part of their routine, right? So we really have to look at and assess how much of this is true overtraining, how much of this is just inherent in their sport, where they're at in their career, and how that impacts performance and what's going on with them. So that brings us to talk a little bit about sport culture norms. Sport culture can be psychologically healthy, but oftentimes athletes might still eat in unusual ways. There can still be just a lot of attention being spent on diet and weight. It is not uncommon for athletes to weigh food before meals, to avoid certain food groups altogether and label them as unsafe or unhealthy foods for their fitness goals. They might plan very carefully for meals, maintain food logs, and they might weigh themselves and measure their body composition regularly. I have worked with athletes in the past who have actually carried tape measures around, right, to measure body composition, make sure that they are doing what they need to do to perform for their sport. that second part of the slide really looks at, okay, so when do some of those things that might be unusual kind of cross into a slippery slope in terms of developing an eating disorder, right? So when it crosses that line and someone is exercising to control weight or body shape beyond a normal training load, so doing more and always feeling like I have to do more, I'm not doing enough. Increasing that load without a clear goal, right? So some of this obsession might be happening. It might be training secretively, doing stuff outside of what's recommended, lying to coaches about what they are doing. There can be some engagement in extreme or fad diets, again, without a clear goal. I worked with a college swim team where one athlete decided to go vegan and shared her reasonings, and a lot of other athletes just kind of started hopping on board, not necessarily knowing why, just kind of following suit there. And then, of course, engaging in those typical eating disorder behaviors as well. So I want to talk a little bit about risk factors just from a sport culture perspective. So on the left side of the screen, I have this kind of general risk factors for eating disorders, but there are some sport specific ones that are important to note. So what we know is that a really early start in sport or an early specialization in sport can lead to more risk. So again, that's going back to that research that shows the longer an athlete participates in sport, the longer they may be at risk of developing an eating disorder. We know that sport type very much impacts the development of an eating disorder, with weight class sports being the most frequent. Same with aesthetic as well. That's not on there, but that's important. Paying attention to traumatic sport injuries. So major injuries. It is not uncommon for athletes who are used to training, get hurt, have to take a period away from sport and become very concerned about the return to sport. And so feel like they have to compensate and figure out ways to maintain their fitness while injured. Undesirable body changes. So this could be injury or otherwise. I know that transition from high school to college athletics, I will see a lot of athletes who are, for example, strength training a lot more and will develop more muscle or just differences in body tone that very much impact their body image and lead to disordered eating. The team environment becomes really important as well. So what is the coach and the team influence? I've worked with several collegiate runners who, because of their culture, what's talked about, what's not talked about, will influence their own relationship with disordered eating. So for example, competitions among college runners to see who can eat the least and run the most in a certain day, and being able to say, right, well, I just had coffee and then I ran 20 miles. What about you, right? And these are aspects of teams that can really perpetuate some of these issues. Team uniforms as well. Just recently worked with a volleyball player, for example, who had a lot of things to say in terms of spandex shorts and how form-fitting jerseys were, how that impacted her body image and experience with her eating disorder. Seasonal status, so being in sport versus out of sport, having breaks versus no breaks. And then performance level. So again, is this a high school athlete? Is this a college athlete, professional athlete? And so how much pressure might they feel? What might be at stake for them? How connected is that to their identity, et cetera? And then again, just that overtraining. So athletes getting rewarded or praised for doing more and then feeling like, okay, in order to continue to excel, I have to do more and more. Sport type. So again, this is just kind of breaking down something I've already mentioned. There are definitely socio-cultural pressures, high risk sports. We've already talked about this a little bit, but we've got that aesthetic sports, leaner endurance sports, weight, anti-gravity, and then high intensity sports. What research has shown so far is that there is seemingly lower risk sports, which is ball sports. So we don't see quite as much, for example, in basketball or football as we might a triathlete or a ski jumper. All right, we've got to talk a little bit about personality and psychological traits too, because I think one of the trickiest things about treating athletes with eating disorders is recognizing that some of the traits that make them incredibly good athletes also lead to an incredibly strong eating disorder. And some of these traits are also highly desired by coaches, highly praised by coaches. So if we look at excessive exercise, going the extra mile, right? adding extra workouts, staying late after practice, coming early. If we look at perfectionism, right? Athletes who are like, no, I want to get this technique down. So a basketball player who might stay after practice and put up an extra 200 shots, trying to correct their follow. Over compliance, right? So a coach might have a couple recommendations and then coach sees that athlete complying perfectly, but again, going above and beyond. That high achievement orientation, so always wanting to do more, always wanting to set goals and keep going. And then also some obsessive compulsive tendencies. So again, those personality traits that make it so that you can't stay after practice, run extra laps, so that you can stay and put up extra shots, so that you can stay and watch extra hours of film and really get immersed in trying to figure out how to be better at your craft. Perfectionism in particular was found to be a central confounding factor in the relationship between athletes and eating disorders, and we're seeing more and more connections between how perfectionism is manifesting in those eating disorder behaviors. I threw this slide in here too, just to kind of highlight some of the performance consequences of athletes with eating disorders over time. As I mentioned, many athletes will see an initial success once they start engaging in disordered eating, and so that can really perpetuate this belief of like, hey, I performed the best when I started with my eating disorder, so I really need to maintain that. And so this is something I really like to use with athletes to help them understand that over time, even if they experience that initial bump, eventually we're going to start to see some of these things come into play. So increased injury risk, decreased training response, impaired judgment, decreased coordination, concentration, more irritability in relationships, some depressive or anxious symptoms, decreased glycogen stores, decreased muscle strength, and ultimately decreased endurance performance. And that red's in the middle, that's relative energy deficiency. So that is something that we see quite often in athletes who overtrain, right, and underfuel. I won't talk too much about that tonight, but something that's addressed pretty frequently in this. So moving to this next piece, how do we support an athlete with either disordered eating or a full-blown eating disorder? I think a really great place to start is just being able to raise awareness and educate yourself. So all of you being here listening to this is part of that. I think part of it too is also trying to send this message that the mind is also a muscle that must be strengthened. I remember when I first started in this field, one of my supervisors was saying, you know, everyone calls us shrinks, and a message that I try to send to athletes all the time is that we're not here to shrink you, we're here to really make you stretch. And so recognizing that just as you're going to go strength train your calf muscles or your biceps, the mind is also a muscle that needs to be strengthened, especially as you compete at a high level. Another way to support, normalizing the difficulty of topics and aspects of sport culture that can make it really challenging. So just talking through, yes, there are some dynamics within sport that can perpetuate some of these things, and how can we still help athletes have a good relationship with their sport and perform well in their sport, but also take care of themselves at the same time. I think speaking up is a huge part of this too. So looking at an athlete who might be struggling and trying to think through who needs to be involved or who can be involved. Is that parents? Is that teammates? Is that coaches? Is that outside support, such as an outpatient dietitian, therapist, medical provider? I think part of speaking up is also just being curious but respectful. So being able to talk with athletes and talk through, you know, hey, are you okay? I'm just noticing, you know, I'm a little worried about you, and coming at it from a place of curiosity and concern, but not asking direct questions in terms of how much weight have you lost, right? Some of those pieces, we'll talk through that a little bit more too. With that being focused on concern for their well-being, right? Not their body size or shape. So, hey, I'm noticing you're acting a little bit different. You know, I've noticed some changes in you, but not necessarily, hey, I've noticed that you've lost some weight, or just that intense kind of focus on the aesthetic. Stressing the importance of the functioning of their body and proper fueling for health and importance. It makes such a difference. For example, just recently talking to a couple of college coaches who at the end of every practice will kind of hand out a Powerade and a snack and talk to their athletes about hey, you know, just as important as what you're doing here during practice, I need you to fuel and take that just as seriously as well. So kind of normalizing that and having that post workout snack together sends a really strong message about how important that is. Emphasizing health and quality of life over performance. I have so many conversations with high performance athletes who are so focused on wanting to do well in their sport and helping them recognize, but what do you want the rest of your life to look like as well? And trying to get them to recognize they're more than their sport. All athletes will retire at some point, and then they do have the rest of their lives, and hoping that they want health and wellness for the rest of their lives as well. I think another main thing is really supporting recovery days, right? I think sport has such a culture of do more, and really praising and rewarding those extra workouts. But I think also helping push the message of, hey, did you take a rest day today? And that really is good for your body, and that is going to help you perform long term, can go a long way for athletes. I think another huge component is just acknowledging how important the athletic identity is. I know when I was an athlete, I think the first way that I would describe myself was as an athlete. And if you were to ask me other aspects of identity back then, I don't know that I probably could have come up with some things, but I think I was pretty consumed with being an athlete, because it really was my day in, day out, right? So many hours a day and school, right? Everything was just centered around practice and competition, basically. So I think being able to understand and appreciate athletics, that athletic temperament, what it usually takes to be successful, personality-wise in this environment, and the culture of an athlete's environment. I think it's also important just to name and recognize that most athletes do perceive weight loss or weight control as performance enhancing. I also think about what it means to have an athlete be removed from sport. That also means that it typically removes their entire support network and can really compromise their athletic identity, which is something that I know every athlete that has to come to treatment in our program really, really struggles with adjusting to. And then again, just think about this, recalling that ideal athlete. They're going to excessively exercise. They're going to have some perfectionistic tendencies, overly compliant, really high achiever, some obsessive compulsive tendencies, and likely pretty high levels of pain tolerance too. So that's all going to play into their athletic identity, which can make it a little tricky in terms of them being willing to admit and get help for an eating disorder or any mental health concern. So talking about some resources for those in need. So you've gone through the signs and symptoms, some of the risk factors. You've kind of looked through some of these pieces in terms of, all right, I think there's an athlete that might be in need of support. So what does that actually look like? I think part of it can start with, again, who can be or who needs to be involved. So is this, along with the athlete, are there coaches that need to be involved? Is there administration that has to be involved? Parents, guardians, teammates, etc. And then who outside needs to be involved? Does this person need a registered dietitian, for example? And are we looking for a registered dietitian who kind of has that credential and expertise in working with eating disorders, or sport certified? Combination between both is fantastic. Are there outpatient licensed mental health providers with proper training, sport psychologists, general psychologists, counselors, mental performance coaches, etc., who can kind of help with some of these things too. I have at the top there too, is there a higher level of care that's needed? So does an athlete truly need to be removed from their sport and come to a higher level of care to get more of a team approach and really help them interrupt their behaviors, better understand the relationship between exercise and their eating disorder, and help them get healthy so that they can return to the sport? I also have a really great website there on the bottom, Run Fast, Eat Slow, and there's a huge list of resources for athletes that you can go to and check out. So I don't know if we can put that in the chat or if people will get these slides or whatnot, but great. I'll talk through too, just briefly, at a higher level of care, what our approach is really working with athletes. So I'm the program lead for, it's called the Athlete Edge program in Denver. And so we work with collegiate, USOPC, pro and semi-pro athletes who have eating disorders. So we're a pretty specialized program for high performance performance athletes. Our attention is really to help interrupt the eating disorder with a goal of returning to sport and performance. And we really work from a pretty comprehensive, collaborative, sport-informed lens to address the whole person. So we're not just looking at the athlete, we're not just looking at the eating disorder. We're really trying to look at them as a whole person, but really recognize how important and salient the athletic identity is to their treatment and to their goals. So something that we do, our team has a counseling and sports psychologist, which is myself. We have a mental performance coach who attends training sessions with them once they reintegrate back into training and helps getting them back to that pre-performance piece. Does a lot of sports psychology and mental skills training with them. We have a strength and conditioning coach who works closely with their outside coaches in terms of building what that training plan is going to look like. Obviously, while they're in treatment, we start much slower and kind of taper them back up to what it would look like. We have a sport-specific and eating disorder knowledgeable dietitian. We have a family therapist that they see. We have a psychiatrist who's also working on sport certification. And then we have a medical provider as well. We do make it a huge focus to reintegrate training and exercise into their treatment. And so we try to be really thoughtful about what that reintegration will look like and really try to figure out when is the best way, when is it appropriate, when are they cleared. So we look at some objective measures in terms of, how is their heart functioning, DEXA scan, lab work, things like that. But then we're also looking at what is that connection between exercise, training, their eating disorder behaviors. Are they able to complete meals? Are they adjusting to program and really digging into the work and therapy? How are they managing time away from sports? Sometimes that can be a really big indicator. Oftentimes exercise is all that athletes have in terms of dealing with negative emotions and whatnot. So helping them develop other skill sets when they don't have exercise is a large part of the work when they come to treatment. And then we're also helping them really prepare a plan to get back to their life and their sport and figure out how are they still going to fuel themselves properly and do what they need to do while also training and hopefully competing and succeeding at a high level. Last piece about our program is that we really try to look at this again holistically. So we follow a biopsychosocial model. And so really what that means is that we're looking at the physical health of the athlete. We are looking at the social life. So again, really paying attention to that athletic identity. We know that when an athlete has to leave for treatment, they're being removed from their support network. They're being removed from their athletic identity. It can be pretty traumatic. I think the majority of athletes that I work with for a couple of weeks, it really is like, when am I going to return to training? How long am I going to be here? They really just want to get back to what that looks like. And also recognizing too that socially their teammates and their coaches, that's who they spend the majority of their time. But also paying attention to their family structure, and then of course that psychological component. So what sort of coping skills do they have? What sort of social skills do they have? What does their relationship with themselves look like? Confidence, self-esteem, general mental health. Are they struggling with other issues outside of the eating disorder that need to be addressed? So we'll typically try to interrupt that exercise at first. We want the athlete to be either stabilized or restore weight if necessary, and we really focus on getting that eating disorder under control first. And then in time, in a pretty structured manner, we really do try to reassess the appropriateness of returning to sport. We have athlete-focused groups that help them continue to piece apart their athletic identity, different aspects of return to sport, how their sport culture has impacted them, and then trying to get them back into those modified workouts to try to get them to align with previous training and addressing, right, giving them some education, addressing internal and external influences that pop up along the way for their. So that about rounds it out for what I have. I'm totally open for any questions, comments, etc.